Evening, EDIC Part 1 aspirants. Our today's class will be very interactive. That's why I'm saying from the beginning of the class. And our today's topic is environment hazards and toxicology, which would be taken by Dr. Asif Iqbal. He is a senior consultant at Department of Respiratory Critical Care and ECMO Services at Apollo Multispecialty Hospital, Kolkata. His area of interest is in respiratory critical care and ECMO services. Now, please welcome Dr. Asif Iqbal, who is the speaker of today's session.
Thank you, Fatma. Thank you for kind introduction. I welcome all of you, and today I will discuss about the toxicology and the environmental hazards. This topic is very scoring topic for the EDIC and the IDCCM examination. In environmental hazards and toxicology, there are you will get most of the time K type of question, and at least you will get 8 to 10 question in your EDIC 1 examination, and in EDIC 2 examination you will get you will go through the scenario like drowning or your burn. So in environmental hazards, the important topic in EDIC, the drowning, burn, and thermal disorder for the from the environmental. Also, this envenomation, electrical safety, bioterrorism question may become. But these three topics you have to cover before you are appearing for the exam. One is the drowning, second is the burn, and third is the thermal disorder. Similarly, when you are going through the and toxicology, there are 4 or 5 area which is very important. One is carbon monoxide poisoning, other is TCA poisoning, paracetamol poisoning, alcohol poisoning, and your beta blocker or digoxin poisoning. So this 5-6 area you should read and then you appear examination. Otherwise it is very difficult, because unless you know the topic thoroughly, you can't give a right answer. And most of the time from this area is coming K type question, true false. So in K type is the toughest question, because if you know the area properly, in the topic properly, thoroughly, then only you will be able to give a proper answer. So I think you all know the marking system. I'm repeating. In A type question, there are 4 or 5 options. If you choose one option, if it is correct, you will get full marks, I think 4. And if you are wrong, then 0. In K type, there is a partial marking is there. There is a 5 option will be there. And if you mark 5 correct, then you will get 4 marks. If you get 4 correct, you will get 3 marks. If you get 3 correct, you will get 1 mark. And if you do only 2 right answer, you will not get any marks. So be careful about the K type question. Now my first question is, the following statement are true about drowning. The drowning is the second leading cause of unnatural death after road traffic accident. Second option is, the driving response occurred due to cold water stimulation ophthalmic division of the trigeminal nerve. Third, it is unusual to find little or no fluid in the lung of a drowning victim. There are significant clinical difference evidence between patients who have been submerged in salt water as compared with fresh water affecting outcome. And the major electrolyte abnormalities secondary to absorption of large fluid volume are common after drowning. So these are the options. You have to choose true and false answer. So The question, this is a more or less original question, because this question was come in my examination when I have appeared my examination that time. This was the question. So course, this the question they prepare such a way, if you know the pathophysiology and also the management, then only you will be able to attempt all the options. So let's see what about the epidemiology. In the drowning cause estimated 4,000 deaths worldwide per year. Of course, 4,000 reported from the USA. And also there is a other risk factor like alcohol intoxication, drug intoxication is highest cause for drowning, 40% adolescent drowning. And the other risk factor including the epilepsy, trauma, cardiopulmonary disease. Those having epilepsy, we know that they have a high risk of drowning. So in USA and in Western country, remember this is a Western exam, so you have to know the epidemiology of the disease of Western basis, is not in Indian data. So try to read about little bit of Western data epidemiology. Everything is available in the PACS module or in the WOS manual. You have to follow WOS manual thoroughly and the Washington manual of critical care medicine. Most of the doubt you will be clear from these two books, and also PACS module. If you have time, you go through. It is a well structured written, and also there are a few MCQ suggested there. Sometime the similar MCQ you will get in your examination. So in pathophysiology, voluntary apnea and reflex occur upon submersion, and driving response is characterized by apnea, marked generalized vasoconstriction, bradycardia in response to cold water stimulus of the ophthalmic division of the trigeminal nerve. Blood is thrust started preferentially brain and heart. So when there is a cold water exposure in the face, there is a trigeminal nerve stimulation happening, and this causing the bradycardia, your vasoconstriction and the apnea. And also it directly stimulate the heart and the brain, and causing there is a arrhythmia, one of the major cause of death of in cold water. So whatever how perfect you are swimmer, but in a cold water you can't sustain much more time because of this reflexes or arrhythmias. And there another thing is that there is a breath holding followed by laryngospasm. When there is a airway immersion with the cold water, there is a severe laryngospasm. So it is not mandatory that you will during submersion you will get lot of water in the lung, but up to 22 ml per kg of water has been estimated maximal survivable level of water volume in the lungs. So if the person has aspirate less than 20 ml per kg, this person have a chance to survive. And there is a this secondary response of the cold water is the apnea and the loss of consciousness. Next, salt water versus your fresh water downing. Remember, salt water versus fresh water downing, there is an electrolyte difference. The electrolyte in the salt water is a higher concentration, so it causes pulmonary edema. It causes hypovolemia, because lot of salt water if enter in the body, It causes pulmonary edema, but it reduces the intracellular volume. So hypovolemia, hypernatremia, hemoconcentration, and pulmonary edema. In contrary, when there is a freshwater drowning, because it is a hypotonic water, it causes pulmonary edema, but at the same time, it removal of the surfactant, hypervolemia causing dilutional anemia, dilutional hyponatremia, and sometimes hemolysis. And remember one thing, it is whether it is a salt water, whether it is your normal fresh water, drowning, the management is the same, and the long-term and secondary effect is the same. So there is no difference between the management of both the things. And water contamination, when it is a pond or the river water, there is a lot of gram-negative bacteria there. So there is a fungi, there is a protozoa, and chances of Staphylococcus species. And regarding the temperature, you remember that in the cold water, there is already I have mentioned the cold shock, and the more important things that it produces the cardiac arrhythmia. Therefore, in ice water, the strong swimmer cannot do swimming so down quickly. Now, coming to the management of drowning, the basic life support management, you have to follow the basic life support, and you have to give the respiratory support depending upon the condition of the patient, intubation, invasive ventilation, or NIV. Most important thing is the cardiovascular support. The most of the time it is a cardiovascular collapse, so you have to resuscitate, fluid resuscitation, prevent the arrhythmia, and you have to give the cerebral protection. So again, there is a cerebral protection, means whether you will go for the hypothermia, post cardiac arrest hypothermia or not. It's recommended that you go for the post resuscitation hypothermia to prevent the brain damage.